Okay, so that's YouTube. Now we press the browser and we click Live Facebook. Click Go Live. Does it look right?
Yeah, good job.
Sorry, how did you get rid of my tummy? Oh, no, it's all right. No. Hi. Sorry, we're running a little bit late again due to the technicalities of setting up connections to 4 platforms: TikTok, YouTube, Instagram and Facebook. I'm just learning the ropes. So, tomorrow I'm going to do 12 videos which are revisions of videos I did a few months ago, which I hope will be simpler and clearer. And you can tell it's the new version because I've got a more respectable shirt on. um, Sorry, just trying to find the texts that I'm going to do tomorrow because that's what I'd like to talk about tonight. So here they are. The first one is about naltrexone. Naltrexone is a wonderful discovery that was messed up for quite a long time. Around 1960 they decided, they found that our cells had opiate receptors on them and that heroin worked by landing on opiate receptors and getting into the cells and having its effect. And they thought if they could make a medicine that blocked the opiate receptors, then heroin wouldn't work and that would fix heroin addiction. So in Long Island in 1963 they came up with naltrexone. And naltrexone blocks out heroin and addictive opioid painkillers and alcohol extremely efficiently. But the problem is the dose that they got approved, which was a 50 milligram tablet, was far too much and caused very severe side effects. People just wouldn't stay on it. they'd stop and relapse. And one of the doctors I worked with said, oh, they just want to go back on heroin. But I could see that 50 milligram tablets of naltrexone caused very serious side effects. Anxiety, they couldn't relax, they couldn't sleep, they were very uncomfortable. And Dr. Bernard Bihari, New York's addiction commissioner, who had 41 methadone clinics under him in New York, was looking for something better than methadone. And so when the 50 milligram naltrexone tablets were approved, he tried them with some of his patients and found that they wouldn't stay on them because of side effects. And so he just decided, well, they're too strong. And he tried from 1 to 10 milligrams of naltrexone and found 3 milligrams was the best. 3 milligrams blocked the opiate receptors for 3 hours, and that provoked the brain and glands to try to overcome that block by producing 250 to 300% increase in feel-good endorphins chemistry. And when the 3-hour block wore off, all those extra endorphin chemistries made people feel much better and boosted the immune system, because the endorphins chemistry manages the immune system, and prevented people from relapsing to heroin. But there was a problem. The problem was that the first dose of even just 3 milligrams caused terrible side effects if a person still had any heroin or addictive opioid painkiller in them. So they had to stop the heroin and opioid painkillers for 3 days before they could take their first 3 milligrams of naltrexone, and almost nobody could do that. At that time, they discovered they had HIV in New York, which they previously didn't realize, and that many people who were dying weren't dying of heroin, they were dying from HIV. And they got very worried about HIV because they thought it was going to wipe out whole cities. And also, Dr. Bihari treated one person with malignant lymphoma and another person with malignant melanoma, which had spread to her brain, with low-dose naltrexone, and the boost to the endorphins, which boosted the immune system, cured both of those patients. And the one with the lymphoma lived for another 9 years and died of an unrelated heart attack, and the one with the malignant melanoma in her brain lived for another 18 years and died of something else. So he more or less forgot about heroin and concentrated on HIV and cancer, and then he died in 2010. And I didn't know any of this because I was in faraway Western Australia, which is the end of the world. But I was interested in 50 milligram naltrexone tablets and why they couldn't work, because they caused such side effects. And I tried 15 milligrams of naltrexone, then 13, then 11, then 9, then 7.5, then 5 milligrams of naltrexone. And eventually I tried 3/4 of a milligram, and all the other doses had given addicts terrible side effects, but 3/4 of a milligram stopped their craving for heroin for an hour without any side effects. So after an hour I gave them another 3/4 of a milligram, which stopped their craving for another hour without any side effects. And then I found that if I gave an addict, even if they had heroin or addictive painkiller in them, as soon as they started to crave, if I gave them 3/4 of a milligram every hour for 8 hours, that stopped them craving for that 8 hours, and it didn't cause any side effects. And then they could tolerate 1.5 milligrams, a double dose. And if they took 1.5 milligrams every 2 hours for 24 hours, they could then tolerate 2.25 milligrams, which is a triple dose of 3/4 of a milligram. And if they continued to take 2.25 milligrams every 4 or 5 or 6 hours, when they had had no heroin for 72 hours, they could take low-dose naltrexone 3 milligrams. Except that I found that some were better on 4.5 milligrams and some were even better on 6 milligrams. People vary a lot in their weight and their absorption and their excretion and their metabolism rate, and whatever made them feel best the next morning was their best dose, because that was boosting their endorphins, their feel-good endorphins most. So I called that repeated microdose naltrexone, or RMN. And it was just a great breakthrough. Naltrexone was the right chemical, but you had to get the right dose at the right time. And it was RMN starting with 3/4 of a milligram and increasing in steps to LDN after 3 days. And then if they stayed on LDN just in the evenings, usually, a few were better in the mornings, most were best to take the LDN 3 to 6 milligrams in the evening, because we produce 90% of our endorphins between 2 and 4 a.m. during the night. And they wake up the next morning full of endorphins, feeling a lot better, not craving and not relapsing. So that's low-dose naltrexone LDN and RMN, repeated microdose naltrexone. Now, another thing you can do is to make tablets and capsules medicine work faster. This is not that common, but sometimes you want to do that. When you swallow a tablet or a capsule, it takes half an hour to go right down your gut and get into your general circulation by an indirect route through the liver, and it takes half an hour to 1 hour to start to work, and between 1 and 2 hours to work strongly. But if you drop powder medicine on your tongue and suck it and don't swallow it, it starts to work in 5 minutes, which saves a lot of suffering and prevents relapses and breaks addictions. Your tongue is pink or red because the blood vessels are so close to the surface that you're almost looking at blood. And when you drop 1 million microscopic particles of powder medicine on your tongue and suck it, it gets into those superficial blood vessels very quickly and starts to work in 5 minutes, and is working very strongly in 10 to 15 minutes. And it's even better than that. If the powder has a very nice taste to it, and your body gets used to having the taste and then 5 minutes later getting better, after a while, as soon as you taste it, you get a placebo effect and you start to get better in seconds, not in 5 minutes. So that's even better if you're trying to prevent suffering and you're trying to weaken craving and lower doses. So that powder, to do that, doesn't have to have any medicine in it. Just fruit powder or vegetable powder or any sort of powder that has a very nice taste will cause that taste conditioning that gives you the immediate placebo effect as soon as the powder reaches your taste buds at the back of your tongue. It's very important to understand how addictions work and how to make quitting easier. So addictive substances are substances that give you great relief from suffering but don't cure anything. So their relief soon wears off, and because nothing's been cured, you get the suffering again, so you want some more of the addictive substance. So you have some more of the addictive substance, you get relief again, but it doesn't last that long, and because it doesn't cure the cause, the suffering comes back. And every time you take so that's one aspect of how an addictive substance works. It gives relief without curing anything. And the second thing is, every time you take an addictive substance, your chemistry develops a bit of resistance to it. So it works not quite as strongly. So the next time you have to take a bit bigger dose to stop your suffering and also overcome that resistance. And when you take a bit bigger dose to overcome the resistance as well as the suffering, you get even more resistance. And if, say, you drink a bit too much alcohol once a week, let's say on Friday or Saturday, by the next week the resistance is gone. But if you're drinking too much alcohol every day or every second day, each time you drink, your chemistry develops more resistance. And the next amount has to be a bit stronger to overcome the suffering and the resistance. And the next lot has to be a bit more to cover the suffering and the increased resistance. And varying with different substances and how often you take it and how much you take, before very long you have to take a lot, because the addictive substance is relieving your suffering but also overcoming quite strong resistance. And in the end, the resistance gets so strong that you're not getting proper relief from your suffering, because a lot of the addictive substance is used up overcoming the resistance. But then it's really awful time to quit. because if you try to quit, the suffering comes back because the cause hasn't been fixed, and your chemistry has got very distorted or screwed up, adapting to this foreign chemical, this the addictive substance. And if you don't, and then with your very screwed up adapted chemistry to cope with all the addictive stuff, if there is no addictive stuff, you suffer, you crave and hang out very badly. So what can you do about that? What you do is you take a powder medicine from a pocket dispenser as soon as you start to feel craving, which has got 3 powder medicines in it. Medicine that stops the suffering, and medicine that stops the craving, and medicine that stops the cause of the suffering. It's not possible to completely fix everything at once, but it is so much better having this very fast-acting powder medicine, which is a combination of 2 or 3 medicines that fix 2 or 3 things and make you feel much better. So, what's a sensible way to quit an addiction? You get a combination, a non-addictive combination, tasty powder mixture of 2 or 3 powders, and whenever, anytime, anywhere, as soon as the craving or the suffering start, you whiz it out of your pocket and you drop it on your tongue, and it cuts the suffering and the craving and the cause, and that allows you to delay taking the addictive substance and to take less of it. You don't go cold turkey. I'm not in favour of cold turkey. Might be right if it works, but it usually doesn't work. And you try in earlier days, particularly in AA, they were very keen on cold turkey. I heard of one very tragic case where an ex-alcoholic was taking antidepressants, and he went to his AA meeting and they said, "Oh no, you mustn't take medicine, just go cold turkey, just say no, just be strong and brave." So he stopped his antidepressants, and a couple of weeks later, he was a carpenter, and a couple of weeks later he killed himself by shooting nails into his brain from his nail gun. And people who go cold turkey have great difficulty quitting, and they are much more likely to relapse because their chemistry is still disturbed. So what you do is you get this powder mixture combination, you have it in your pocket, you whiz it out and you drop it on your tongue as soon as the suffering or the cravings start. That stops them from getting strong, so you can delay taking the addictive substance and you can take a little bit less. And that weakens your addiction and allows your chemistry to come back to more normal, how it was before it had to adapt to all this foreign addictive substance. And then each day you repeat that and you get a little bit less of the addictive substance a little bit later, and it weakens your addiction a bit more, because the addiction is due to underlying electrical triggers and chemical triggers that flow in your nerves and in your bloodstream, and they've happened over and over so often that they got very strong and very easily triggered and very hard to stop, which is an addiction. And what you're doing is you're reversing that. You're stepping back a bit at a time. So quit addictions by dropping the right powder medicine on your tongue that gives you enough relief from suffering and craving to allow you to delay taking the addictive substance and to take a little bit less. And you do that again until eventually you're down low enough and your chemistry has come back to normal, and you can quit. So how do we do that with alcohol? We take Calm Fast 3 powder medicine, 2 to 6 doses as soon as we wake in the morning, and you repeat it every 6 to 8 hours, and at bedtime, and it starts cutting the craving for alcohol. If you get that stop that craving as soon as it starts and the suffering, then you can delay drinking alcohol maybe half an hour a day, and drink just a bit less, maybe 10%, 15% less, and you just keep on repeating that, and over a period of 1 or 2 or 3 months, your addiction will get weaker and weaker, your chemistry will come back more and more normal, and then you'll be able to quit if that's what you want to do, and you'll be much less likely to relapse, and you carry the Calm Fast in your pocket in case you're tempted to relapse. Because one of the big problems with addictions is that so many people relapse, and having this in your pocket makes it easy to avoid relapsing. Or, you know, some people who've been really bad alcoholics do relapse, but they relapse for a week and then they decide, no, that's not what I want, and they've got the stuff in their pocket and they start again, and they're good for 6 or 8 or 10 weeks, and then they relapse, but the next time they only relapse for 3 days, and then they know that no, that's not what they want, and they've got the stuff in their pocket and they go back. So what do you do for heroin or painkiller addiction? Same thing. Make up your mind that you want to quit the addiction, quit heroin, or get that painkiller if you've got genuine pain back to a level where it's working. It's not got so much resistance that it doesn't work anymore. Carry the Calmfast in your pocket, in the dispenser. As soon as you wake up in the morning, take 3 or 4 or 5 doses, whatever you find is best. If you take too much, you'll be sedated, and it depends what you've got to do, if you've got to drive the car or do work or something. So just find the best dose to take when you wake up in the morning, and take sorry, I got this a bit wrong. With heroin, you take 1 dose when you wake up in the morning, and you can repeat that hourly, and that will reduce your craving without causing side effect, because it's got a microdose of naltrexone in it, and you repeat it hourly. And when you have been able to go without heroin for 8 hours, then you can take double doses, 2 doses of 3/4 of a milligram, which is 1.5 milligrams in the Calmfast. So the microdose of naltrexone is helping you, and also the calming medicine in Calmfast is helping you. So Calmfast is just an alternative to treating the heroin addiction with just repeated microdose naltrexone. Because usually there's a fair bit of anxiety and insomnia that goes with heroin addictions. What do you do with addictive painkiller addiction, or excessive amounts where you've taken too much and it's not working very well for you because of the resistance, because your chemistry has changed? Well, when you wake up in the morning, you take 1 dose of Calmfast 3, and you repeat that every hour, and after 8 hours you can start to take double doses of 1.5 milligrams. And that allows you to take a little bit less of the addictive painkiller a little bit later, and that weakens the resistance to it. And eventually, if you've got no pain, you should quit. You carry on till you quit. But if you've got genuine pain, and what happened is that it stopped working because you took too much, you had to take too much, then you can reduce it, and your resistance to it goes down, and then it works better again. What do you do for crystal meth, cocaine, or ecstasy, MDMA? You want to cut the craving and the suffering that originally caused the addiction, which is often ADD, ADHD, or chronic fatigue syndrome due to a virus infection, or just fatigue from working too hard, and people start to take some cocaine or some crystal meth or some ecstasy, MDMA, to give them more energy, more strength, more focusing better. So we use a powder in a pocket dispenser that I call Upfast. And Upfast is just a mixture of modafinil, which is a stimulant which is not addictive, so any doctor can prescribe it. The ADD medicines, dexamphetamine, Ritalin and Adderall, are all addictive, so only pediatricians and psychiatrists are allowed to prescribe them. But modafinil is not as strong as them, but it's not addictive, and it has the advantage that it works for 8 to 12 hours. And I mixed that with microdose of naltrexone, which boosts their endorphins, their feel-good endorphin chemistry. And when you wake up in the morning, you take Upfast, usually one dose per 44 pounds or 20 kilograms of your weight, and repeat that after 6 to 8 hours. If you take it too close to bedtime, it may interfere with your sleeping, so often you take it first thing in the morning and 4 o'clock in the afternoon, something like that. So Upfast, in your pocket, in seconds, on your tongue, sucked, not swallowed, starts to work in 5 minutes, then soon starts to work in seconds as soon as you taste it. And that enables you to take a little less crystal meth, cocaine or ecstasy, MDMA, a little later, which gradually weakens the addiction, so you can take less and less and less, and quit it, preferably quit it. You don't have to quit if you don't want, because when you get it down over a lengthy period of time, it'll work a lot better, so you won't need to take nearly as much. But it's usually safest to quit crystal meth, cocaine and ecstasy, MDMA. What about tobacco? Tobacco kills 7 million people a year in the world. For everyone it kills, it ruins the health of many, many more, and some of their family, because the tobacco smoke affects people who are in the same room as you if you're smoking. So we got a mixture that I call Tobacco Fix, and Tobacco Fix has got some tobacco smoking, nicotine, does 3 things for you. It gives you a bit more energy, it lifts your mood a bit, and it helps you focus and concentrate better. And Tobacco Fix does all 3 of those things. But whereas tobacco smoking is very addictive and very harmful, Tobacco Fix is not addictive and it's not harmful. and it's got a small dose of modafinil to give you the boost in uh, energy and a little bit of a boost in mood, and it's got a very small amount of nicotine in it. The nicotine tablets you can buy to help you stop smoking have got 4 milligrams of nicotine in, but a dose of Upfast has only got half a milligram. We do that because it helps people to come down a bit quicker, and when they come down from big amounts, then it's quite easy to jump off half a milligram. And of course it's got microdose naltrexone in it to boost their feel-good endorphins. And of course you should also on your phone find the App Store or Google Play icon, click it, and in 10 seconds download the Mental Fix It app, and in 5 minutes do the Mental Fix It app check and find out what caused you to smoke in the first place. With all addictions, you should do that. And I say 5 minutes because our Mental Fix It app used to take 10 minutes to do, and we found that people thought that was too long. So we eliminated the less important questions. So now there's less questions. You can do it very quickly. At the first time, 5 or 6 minutes, but very soon you can do it in 2 or 3 minutes, because it stops asking you questions that aren't relevant to you, and you've tapped no, not a problem twice. So with addictions, you want to find the cause and fix it. Addictive substances are addictive because they don't find the cause and they don't fix the cause. Yeah. What do you do for addictive tranquilizer craving? I saw lots of people taking 20 or 30 Valium tablets a day, 8, 10 or 15 Stilnox or Ambien a day. Far too many sleeping tablets, because nearly all anxiety and sleep medicines are addictive. Well, you take Calm Fast, and Calm Fast has got baclofen in it, which is a very good tranquilizer. It's only slightly addictive. It is slightly addictive if you take it on its own, but it's also combined with an antidepressant that has a very strong calming effect, and microdose naltrexone, and that combination is not addictive, and that it helps you to be a lot calmer and happier, and then you can take the addictive tranquilizer a bit later, a bit less, and that reduces your addiction and your resistance, and the next day you can take it, or soon you can take it even a bit even less and even later, and you just keep on doing that until you're down to such a low dose of it that you can quit if you want. Some people won't want to quit if they know how to fix it. If they start to take too much, well, they'll still take some. Your decision, but you need to have control over it. With marijuana, you do very much the same. I'm not saying you should quit marijuana. That's your decision. But if you're smoking too much marijuana, that can be a problem. And I've seen people. I can still picture a man who came to see me because he was smoking far too much marijuana, and it was worrying him, and I didn't know what to do then, but now I know. All you do is you take Calm Fast and get it back down, and when you're taking less it works better because your resistance to it reduces. So Calm Fast is a very useful triple medicine powder non-addictive combination for worry, anxiety, poor sleep, PTSD and pain, for alcohol, heroin, addictive painkiller, and any calming substances that you might be addicted to or might be taking too much. You can reduce it and it will become more effective again. So what are the advantages of non-addictive, tasty, tongue-absorbed powder medicines in pocket dispensers? Mental health problems and addictions are in a way a sort of habit. They're things that have happened so many times that the triggers, the electrical messages that flow in your brain and your nerves, and the chemical messages that flow along a line of cells or flow in your blood have got stronger, stronger and stronger and more easily triggered and harder to stop. And if you can stop them as soon as they start, they won't get strong, and you can weaken the triggers, the electricity and chemical flows that cause them. You can break them gradually back to normal. There are other non-addictive calming medicines. Mostly I find that the 3 medicine combination of Calm Fast is the best, but sometimes there are single medicines that in certain situations are better. So they're major tranquilizer antipsychotics like aripiprazole, mood stabilizers, which are really anti-epilepsy medicines, like lamotrigine and carbamazepine. A calming antidepressant, wonderful calming antidepressant, mirtazapine, low-dose naltrexone, and repeated microdose naltrexone. And baclofen, which is a 1920s medicine that was developed for epilepsy, but then they got better medicines for epilepsy, so it wasn't used for that, but it was still the best muscle relaxant medicine. I used to prescribe quite a lot of it about 30 years ago, when I was looking after 100 paraplegics and quadriplegics in a nursing home. And paraplegics and quadriplegics often get muscle spasms, and that was the best medicine for muscle spasm. I didn't realize at the time it was also a tranquilizer. But a woman doctor in New York in the late 1990s had a paraplegic man who was a cocaine addict, and he couldn't stop the cocaine, and he got muscle spasms, and she gave him baclofen for his muscle spasms, and he stopped the cocaine. And that got written up in the New York newspapers, and there was a famous professor of cardiology in New York at the time, Professor Olivier Amerson. He was French originally, and he had a terrible alcohol problem. When he was a teenager, he was a great pianist, and he used to play the piano in front of big crowds, and he used to get very anxious. It wasn't hard to get alcohol in France, and that calmed him down, so when he was performing he used to take alcohol, but then he took more and more and more. And with the stresses and strains of becoming a famous professor of cardiology, his alcoholism got very, very bad. And when he read in the New York newspapers about this paraplegic man who stopped cocaine with baclofen, Professor Amerson thought, well, he had nothing to lose. He'd been to the 3 best rehabs, he'd taken every possible treatment for alcohol, none of it worked, he always relapsed within a couple of days, so he thought he'd try baclofen. And baclofen just worked wonders for him. He had to take high doses, but it controlled both the alcohol craving and the anxiety so well that it just completely changed his life. He could even have one drink and stop. He didn't usually like to drink at all, but sometimes there were social situations where he would have one drink and then stop, which alcoholics usually can't do. A reformed alcoholic usually has one drink and they're gone again, but it worked wonderfully for him. So he wrote a book called The End of My Addiction. The End of My Addiction. And I somehow, I can't remember now, how found that book and read it and thought, wow, this is wonderful. And I gave baclofen to all my heroin addicts who mostly had awful anxiety and insomnia. And it worked wonders for most of them, but there were 2 who took too much. I can't remember one of them now, but I remember one of them was an Asian lady who got up to 9 baclofen tablets a day, which worried me. It was still much better than heroin and much better than Valium or Seropax. But then I mixed the baclofen with the calming mirtazapine antidepressant and microdose naltrexone, and that combination was even more effective, and it reduced the amount of baclofen people had to have and so it overcame that problem. Another combination medicine that I make, I call low day fix and low night fix. People who are depressed have a problem in that the doctor just gives them a prescription for an antidepressant, but antidepressants can take 2 or 3 weeks to start to work, and a person can get pretty despondent in that 2 or 3 weeks waiting for it to work, and they may start to take addictive street drugs. But I found that if I mixed an antidepressant with some fluoxetine, which is a stimulating antidepressant, if I mixed so the fluoxetine is a stimulating antidepressant for people who get depressed mostly in the morning and have low energy. But it is an antidepressant. It does take 1, 2 or 3 weeks to start to work, and in that time they may go astray and start to take street drugs, addictive street drugs. So I mixed fluoxetine with some modafinil, and modafinil starts to work in half an hour, and they immediately feel better. It's more a stimulant than an antidepressant. Modafinil is more a stimulant than an antidepressant, but they feel better, and that helps them to hang on until the antidepressant effect starts to come through. Or for people who get depressed mainly in the evenings, I gave them what I call low night fix. And low night fix is escitalopram, which is a non-stimulating antidepressant, plus some microdose naltrexone, which boosts endorphins, which makes them feel better, plus some baclofen, and if the antidepressant, as it usually does, takes 1 or 2 or 3 weeks to start to work, the other medicines work straight away, and they feel encouraged and are less likely to, say, drink a lot of alcohol or take other things to calm them down. And of course, some people need to take low day fix in the morning and low night fix in the afternoon. Another combination medicine is Upfast 60. I call Upfast 60, and that's a combination of modafinil, which is a stimulant, and some low-dose naltrexone, because often people don't just have one problem, they have 2 or 3 problems. If they've got ADD and they need a stimulant to wake up their front of their brain, and they can't get they can't get Ritalin, dexamphetamine or Adderall because they can't afford to see a paediatrician or a psychiatrist, or the waiting lists are too long, but they can see the local doctor. Then they can get modafinil, which is a non-addictive stimulant that all doctors can prescribe, but mixing it with some microdose or low-dose naltrexone that boosts their endorphins, their feel-good endorphins, is more effective than modafinil alone. And then there's AngerFix. Australia is going through a terrible time of domestic violence. It's become a really big problem, with one woman being killed every 4 days by her partner or ex-partner. And for everyone that's killed, there are a lot who are terrorised, who have to run away from home and live in a refuge or live on the streets. And domestic violence is a really serious problem. And there didn't seem to be a recognised medication for anger. It's irritability, anger, rage and violence. It's a spectrum, and it's everything from people who just fly off the handle a bit too quickly through to people who are very violent. And so I call it IAD, irritability anger disorder, IAD, irritability anger disorder, and I treated them with AngerFix. And AngerFix is a combination of baclofen, which is a calming, tranquilizing medicine, and a mood stabilizer, which is this, and epilepsy medicines, because epilepsy medicines seem to help these people, and lamotrigine and carbamazepine seem to be the best, and some low-dose or microdose naltrexone. And they just have this in their pocket, powder form, and that the first feeling of irritability or anger, they whiz it out and drop it on their tongue, suck it, don't swallow it, and within 5 minutes they start to calm down. And that prevents a lot of bad situations, but it also helps to break it, because IAD, irritability anger disorder, is really a habit. It's something that's happened so many times that the electrical messages in the brain and nerves and the chemical messages running along lines of cells or in chemicals and hormones in the blood have got stronger and stronger and stronger till they're fast and very hard to stop and are triggered very easily. And I think quite a lot of it starts in early childhood with unhappy situations that make kids angry, and it becomes a habit. And you need to break that habit, and you can break that habit by just taking the anger fix right at the beginning of every episode, or even before it starts. If you can see someone coming that makes you angry, or you're going into a situation where you get frustrated and angry, before you even get there, you stop it. It's much easier to prevent episodes coming on than to make them go away once they're established. So you need fast acting powder, and you need it in your pocket in a dispenser, and every time you stop it, every time you nip it in the bud, you not only prevent that particular attack, you slightly weaken the triggers, the electrical and chemical triggers, and you weaken, and might take you a year, but if you can go for months and months and months without ever getting really angry, you will have largely broken that habit. Tobacco fix is another combination. It's got well, tobacco does three things for you. Nicotine does three things for you. It gives you a little bit more energy. It lifts your mood a bit, and it helps you to focus and concentrate better. And tobacco fix, but it's very addictive, and it kills 7 million people a year. And for everyone it kills, it causes very serious health problems for many more. Tobacco fix just contains small doses of modafinil, which is a moderate non-addictive stimulant, which helps the energy and the mood a little bit, and some microdose naltrexone, which boosts the feel-good endorphins chemistry. And you have it in your pocket, and every time you feel like a smoke, you whiz it out, drop some on your tongue, and postpone the smoke, the cigarette or whatever, for a while, and then smoke a little bit less. Throw the cigarette away when there's still a quarter there, and you weaken the underlying electrical and chemical flows. So as a doctor for 53 years, in which time I had 500,000 consultations, home and hospital visits, I was always interested in the people who suffered the most and got the worst treatment. And that was definitely addicts, and then when I treated addicts, I found they all had mental health disorders which had caused the addictions. The addictions made the mental health disorders worse, and sometimes created new mental health disorders, but the fundamental underlying problem was mental health suffering that didn't get proper treatment and resulted in street treatment, and street treatment is always addictive. And what I realized was that a lot of people were getting no help, and almost nobody was getting enough help. And there were two ways of dealing with the situation. There was talk therapy or psychotherapy, and that had two very big problems. One was, to be a therapist, you had to have a 4-year psych degree, or a 7-year PhD, or a 6-year medical degree plus 4 or 5 or 6 years of psychiatric training. So those people were highly trained, pretty costly, and there was never going to be enough of them. And also, psychotherapy was very slow. It took a long time to make a diagnosis, to find the problems and what caused them, and to explain everything to the patient, because they need to understand. To get better, they need to understand, and most of them never got proper explanations. And the other problem, the other tool for mental health and addiction problems was medicine. And medicine had a great weakness. The weakness was the people who were taking it wanted it to work quickly and fix them. The people who were making the medicine wanted them to stay on medicine as much as possible, as long as possible. So a lot of the medicines were addictive. Nearly all the anxiety medicines, which is the commonest mental health problem, were addictive. Nearly all the sleep medicines were addictive. And ADD, the three main medicines, Ritalin, dexamphetamine and Adderall, were all addictive. So people had tended to stay on medicines for a long time, and they had to keep on getting repeats, and that clogged up clinic times. There were all these people coming back for repeat medicines for years and years and years. So I developed a package of 7 tools. The 7 tools were under-a-minute videos, over 100 of them, which enable people to... A video is the easiest, quickest, lowest cost, most convenient way of learning about a mental health or an addiction problem. And you can watch a video over and over again until you get it. And a lot of people who have consultations get confused and don't get it. And then websites. I had a website called, or I have a website called the Mental Health Videos A-to-Z.com. But it's very long and detailed, which I tend to do, and so we realised that just as people wanted 1-minute videos, not 10-minute videos, we needed to have a shorter website. So now we are developing one only half done, but it's there, called smilefixit.com. smilefixit.com. And then the next thing was an app. I started with a checklist, and that was helpful because my assistants could do a checklist, and when I was so busy, I had to do it that way. It would take me 20 or 30 minutes to understand a patient, and that was going pretty fast and not that thorough. But if one of my assistants did the 20 question checklist with them first, and I could do that in 5 minutes. But with the advances in technology, it was apparent that an app on your phone was far better than a paper checklist and a nurse. But apps, of course, are a lot of work, and they're very expensive. But I got lucky, and I found a very smart foreign student doing his Masters of Information Technology who helped me make the Mental Fixit app. But we've just shortened that from 10 minutes to 5 minutes. Well, we're in the process of doing that, and we're going to add facial recognition. So 1-minute videos, websites, a Mental Fixit app, and live streaming. I learned about live streaming for the first time about 5 months ago. It's a different way that a lot of people prefer. So I do live streaming for an hour and a quarter on Wednesday, Friday, Saturday and Sunday, usually at 7 o'clock, but lately we've been a bit late because I've been coping with how to deal with the technology. So I'm on 4 platforms, not just one, and we may start to do one of those sessions at a different time, because we do them at present at 7 o'clock Perth time, which is 9 o'clock Sydney and Melbourne time, which is pretty convenient, seems to suit a lot of people. But it's 7 a.m. in New York, and it's 4 a.m. in Los Angeles, and surprisingly we get quite a few viewers from the US and Canada and the UK, but I probably really should try to do one session at a time that would suit them better. So that's 4 tools. The 5th tool is the powder medicine. The 6th tool is the pocket dispenser that makes the powder medicine so much better. And the 7th tool is a cut down stethoscope, which I call a heartbeat meditation aid, because what is meditation? Meditation is a little holiday from all your troubles. And how do you do that? You focus on something that lets you forget everything else. But what the experts say you should focus on is your breathing. Your breathing is not a very attention-grabbing thing, And so a lot of people who would benefit most from meditation, very anxious, agitated, hyper people, can't do that, and they need a stronger thing to focus on. And I found that listening to your heartbeat was pretty effective. Your heartbeat is loud and clear and interesting and attention grabbing. And if you do that for a couple of months, from 5 to 30 minutes usually, and you establish the habit, then you can switch to focusing on your breathing. But I'm going to do a new one, which I call smile, taste, breathing. Because if you put a lovely taste on your tongue, you can focus on that, and that's attention grabbing. And smiling is helpful because we all know that when you're happy, you smile. We've got about 25 chemicals in our brain that make us happy. There's over 20 endorphins, endogenous morphines. Yes, we produce morphines internally. There's over 20 of them that make us, that help to control pain, reduce stress, and make us feel happier. And then there's dopamine, serotonin, oxytocin, noradrenaline. And those things make us happy. And when they're good, we smile and we laugh. But what we didn't know, but science has now proven, is that when you smile or laugh, you produce even more happy chemistry. And it's better than that, because when you smile at someone, they smile and they feel better and you feel better, and that's very important. So that's another tool that we need to work on. Yeah. Well, I think that's enough for one day. So I wish you well. If you've got any questions or comments or criticisms, how I could do things better, please send them. I look at them every evening after I do the live streaming, and the next day stuff that came in during the night, and try to learn from them and try to respond and communicate with some people. But I'm very old and not good at technology, so if I missed you, I'm sorry. Yeah, okay.